Dear friends, do not panic. Rather be patient. Rather be productive. That's my message on COVID-19 situation at the moment. I'm a founder and director for a biotech company in India, and since we are involved with the COVID-19 work, uh, so I feel that I have some ideas which I can share with you. Learning is a two-way process, so we all learn from each other. So I feel like sharing what I understand about this situation, which has created havoc globally. First and foremost, I would talk about immune system. Immune system is body's defense mechanism, which tells you how to, which makes sure that you fight all the invading microorganisms, be it bacteria, be it viruses, and keep them in check. When immune system encounters a microorganism or a foreign particle, it kind of develops response against it. uh, it memorizes, and then whenever such an attack happens in the future, so it's actually ready to fight it with even more force. So it's very important for all of us to take care of our immune system. uh, we have to have sound sleep, we need to have good nutritious food, we need to have exercise, and above all, you must have heard a lot, you need to sanitize yourself very well. You have to stay away from infection, and you have to break the chain, which is kind of becoming the main problem here. This particular infectious agent COVID-19 is very infectious, so it spreads very fast. But good thing is, it is not fatal. It does not kill each and every one. So a lot of people who have got strong immune system, they are able to fight and contain. But at the same time, they do have the risk of spreading it to others. Now, call it as Mother Nature's revenge. Humans have been doing all sort of excesses for all these years, and this was supposed to happen anyway. And this is Mother Nature's way of cleaning the things, keeping things in balance. So this is also uh, a point when we really should understand that how important it is to have uh, ethical behavior while you are staying on the earth. Okay, viral spread has also shown that it's not differentiating between rich and poor. Uh, so irrespective of who you are, irrespective of your financial status as of now, everyone is equally prone. So this is something which is not going to look at you and then decide. It is actually you who have to stay away from it in all the circumstances. uh, Good thing is there are a lot of people who are immune. So experts worldwide, what they are saying is that these kind of people actually should come forward, and because they are not developing the disease, they are immune, so they can come forward and help others. And at the same time ensuring that they do not infect others. So they should quarantine themselves, for a particular period, and then once everything is fine, so they are the ones who can actually uh, associate in this whole fight against COVID-19. The major crux lies how best we test people and how the speed of testing can be increased. So there is a confirmatory methodology by name RT-PCR, which is kind of being used globally for screening people who are COVID-19 positive. But I have emphasized in a lot of my previous messages that it will be actually the rapid test, which will be antibody based, which will be able to screen much faster, and we can embrace a lot of people in that particular testing. uh, People taking too much time, uh, people taking too much liberty, outside their homes, uh, people who are panicking, they are the ones who are actually going to spoil the show completely. So I would strongly suggest, do not panic. rather do participate. Uh, do not take too much liberty that nothing happens to me. uh, Across ages, though, it's more inclined to kill people who are of low immune system or people who are old. uh, so do take care of your old ones properly. They need to be sanitized, they need to be at a place where the risk of infection is less. And when you are sitting alone, or when you're working from home, or if you don't have much to do, so use this time to build on your strengths. Use this time uh, to hone your skills, educate yourself, uh, prepare yourself more and more in whatever capabilities or whatever fields you are working on. Financially, there is going to be huge impact. uh, so stay in cash, I would say. uh, do not go by wrong advices or anything. It's always good to stay in cash. So that's another message which I feel. I'm not an expert on finance, but this is what I feel for everyone. So be careful about your money. uh, Societies, RWAs, panchayats, municipal communities should continue to lay uh, correct measures so as to ensure that infection does not spread. And I have seen a lot of government efforts in that direction, commendable. A lot of RWs I have seen, they're doing pretty well. They're isolating their societies from rest of the world in best possible manner, at the same time taking care of essential needs of their residents. So I really do appreciate that. And one thing which we should not forget, I think we have not been grateful to God for whatever best things have been given to us. All these blessings. In terms of comforts of life, in terms of automobile, travel, families. So this beautiful world, fruits, flowers. So it's important for us to have the gratitude, which all of us forget at time. So it's important to realize that and take care of Mother Nature in a very productive way. Stop rumors. Again, I will say, don't panic. If someone develops symptoms, so make sure that you call the right people, get them tested, uh, uh, isolate them so that other people do not get infected from them, but at the same time they are well being taken care. uh, on the vaccine front, globally, there are a lot of efforts, and I have shared in my clippings and media already, that people are working on vaccines. They are working on polypeptide vaccines, synthetic vaccines. They're trying to isolate proteins. They have expressed recombinant proteins by genetic engineering, and these vaccines will happen, and a lot of them are under testing at the moment. But my best bet would be it will still take almost around uh, a year's time to come out with a very effective vaccine. Uh, but rest assured, so work is on that particular front. Uh, there are a lot of drugs which are being tested, and we all have heard about drugs against uh, other coronaviruses, antiretroviral drugs in particular, then some of anti-malarial drugs. They are all being tested, but do not take anything without advice of uh, your doctor or qualified people. But this is just to share with you that efforts are on in that direction. Uh, we have the world today is very different from 1918, when this flu killed so many people. Uh, this time, we have genomics, we have proteomics, we have artificial intelligence, we have a lot of data which is available, we have awareness through social media, uh, and the most of the people globally are so very well connected, governments are so much connected. So I do feel that this time we as a human race will be able to contain it with much better efficacy. But at the same time, the points which I have mentioned, let us be careful for future as well, and fight this pandemic with full synergy. Thank you very much.